is for educational purposes and general information. So don't take this as medical advice. And this is my experience as a trans woman who has taken this in the past before being switched to the injections. So, what is estrogen? Estrogen is a hormone that's responsible for the main sexual characteristics in females, which males have a little bit as well. Sorry for the kitties. That's what that noise is. And it helps with when going through puberty. Helps with your breasts growing, your hormone cycle alongside progesterone. Helps with those two as well. Helps with like your bones and your overall physical health. Does a lot for your body. So I'm going to be using these notes I got with my prescription. It's just the general basic, just to give you information if you're thinking about going on the pill. If you can't take the injections, the pill is a great alternative if you can't take the injections for any reason. So, I'm using the notes. It's Estradiol Oral Tablets. There's two different ones. There's 2 milligram and 1 milligram. The 2 milligram is an oval shape, and it's kind of, they say it's green, but it's like a bluish green. And the 1 milligram's more of like a tan color. So estrogen may raise the chance of uterine cancer. Progestins may lower this chance. Progestins are the more synthetic version of the progesterone. Warning signs of cancer of the uterus is vaginal bleeding. Reports any vaginal bleeding to the doctor. So always talk to your doctor before starting any kind of medications of any kind. Do not use estrogens to prevent heart disease or dementia. Using estrogens may raise the chance of having a heart attack, a stroke, breast cancer, a blood clot, or dementia. Use estrogens with or without progestins for the shortest time needed at the lowest useful dose. For my situation, I was on 2 milligrams for a while. I was put on the 4. Then I was on 4 milligrams for the longest time. Then I was up to 6. And then I was switched to the injections, and then hormones. You can tell the difference when you're on a higher compared to lower, from my experience. What is the drug used for? It's used to put off short, brittle bone osteoporosis in women after the change of life. It is used to prevent or lower the signs of the change of life, menopause. It is used when the ovaries have been taken out, are not working the right way, or have stopped working. Rarely it is used to treat breast or prostate cancer. It may be given to you for other reasons, so talk with your doctor. For me, I'm a trans woman, so it was prescribed for me when I was on it for hormone replacement therapy to have a normal female hormone cycle. What do I need to tell my doctor before I take this drug? Okay. If you have any allergy to estradiol or any other part of this drug, which estradiol is this specific version. There's like 4 different estrogens. One's only present when you're pregnant, and the O estrogen is the bad one for your body. It can basically cause all this bad stuff when it's too high, like cancer and other things. But the estradiol, that specific one, it's meant for your normal hormone cycle. What's the highest in your body that gives you all the characteristics and other functions of your body. Yeah. If you are allergic to any drugs like this one, any other drugs, food, or other substances, tell your doctor about the allergy and what signs you had, like rash, hives, itching, shortness of breath, wheezing, cough, swelling of face, lips, tongue, or throat, or any other signs. If you have ever had a very bad or life-threatening reaction called angioedema, signs may be swelling of the hands, face, lips, eyes, tongue, or throat, trouble breathing, trouble swallowing, unusual hoarseness. If you have had any of these health problems, bleeding disorders, blood clots, a high risk of having a blood clot, breast cancer, liver problems, or liver tumor, heart attack, stroke, or a tumor where estrogen makes it grow. If you have eyesight problems like loss of eyesight from blood vessels, problems in the eye, if you have any thickening of the endometrium lining of the uterus, if you have unexpected vaginal bleeding, if you are pregnant or may be pregnant, do not take this drug if you are pregnant. If you are breastfeeding or plan to breastfeed, this is not a list of all drug or health problems that interact with this drug. Okay. Tell your doctor or pharmacist about all of your drugs, prescriptions, over-the-counter, natural products, vitamins, and health problems. You must check to make sure that it is safe for you to take this drug with all of your drugs and health problems. Do not start, stop, or change the dose of any drug without checking with your doctor, even the dentist. Because I recently had seen the dentist and they're saying some of my issues like pain through here or sometimes bleeding can be caused by prescriptions. Mostly not really the estrogen but progesterone I'm taking. So estrogen may do that as well. So be aware of that when you floss. So yeah. What are some things you need to know or do while taking this drug? Okay. Tell your doctor, tell your healthcare provider that you are taking this drug. This includes your doctor, nurse, pharmacist, and dentist. If you are allergic to tartrazan, talk with your doctor. Some products have tartrazan. If you have high blood sugar diabetes, you will need to watch your blood sugar closely. High blood pressure has happened with this drug, like this one. Like drugs like this one, have your blood pressure checked as you have been told by your doctor. Have blood work checked as you have been told by your doctor. Talk with your doctor. Have any bone density tests as you have been told by your doctor. Talk with your doctor. Be sure to have regular breast exams and gynecological checkups. Your doctor will tell you how often to have these. You will also need to do breast self-exams as your doctor has told you. Talk with your doctor. Like, for me, I do breast exams once every month, sometimes more than once a month, because during your hormone cycle, your monthly hormone cycle, your breasts change during that time. So they may feel different. So you want to, before your hormone cycle, during your hormone cycle, and after, when you do the exam, that way you know the difference between before, during, and after, how your breasts are. That's how I learned how my breasts, like the tissue and the ducts and everything, the fat, and how everything sits in it, how everything feels. So I know what's what during each one. So you know it's not something that it should be or shouldn't be. This drug may cause dark patches on the skin or face. Avoid sun lamps and tanning beds. Use sunscreen and wear clothing and eyewear that protects you from the sun. And yes, I've noticed I get sunburned a little bit. It's like I always got sunburned easily, but it's a little bit more now. Especially where there's more exposed skin around the shoulders or the legs. Yeah. This drug may affect certain lab tests. Tell all your healthcare provider and lab workers that you're taking this drug. Do not smoke. Trust me, just don't do it. I never smoked in my life, but I know that increases your chances, badly increases your chances of cancer and other bad diseases. Smoking raises the chance of heart disease. Talk with your doctor. Limit your drinking of alcohol. Yes, I do drink once in a while. It's like rarely. It doesn't really affect much. Sometimes I feel the difference, how it reacts with certain parts of my body, like my breasts, for instance, and how it feels towards things like that. Like if they were growing, how they feel. I feel that sometimes when drinking while I was taking the estrogen. If you drink grapefruit juice or eat grapefruit often, talk with your doctor. Talk with your doctor if you will need to be still for long periods of time, like long trips, bed rest after surgery, or illness. Not moving for long periods may raise the chance of blood clots. This drug works best when used with calcium, vitamin D, and weight-bearing workouts like walking or PT, physical therapy, which I have taken a multivitamin, and it does help a lot, because on hormone replacement therapy, you will be low in vitamin D. It doesn't matter if you're male or female, trans or not. It doesn't matter if it's male hormones or female hormones, you will be low, especially at certain times of the year, like towards the winter months. You will be low. Maybe even more so than normal. Follow the diet and workout plan that your doctor told you about. This drug may affect growth in children and teens in some cases. They may need regular growth checks. Talk with your doctor. Yes, I wouldn't suggest kids taking it, but at the first signs like of puberty, especially if it's a trans girl starting to go through that puberty, you may need to go on it. I suggest, based on an individual basis, I can't say it's right or wrong for anyone, but talk with your doctor and your parents and figure out a plan that works for you. If you are 65 or older, use this drug with care. You could have more side effects. What are some side effects that I need to call my doctor about right away? Warning, caution. Even though it may be rare, some people may have very bad and sometimes deadly side effects when taking a drug. Tell your doctor or get medical help right away if you have any of the following signs or symptoms that may be related to a very bad side effect. Signs of any allergic reaction like rash, hives, itching, red, swollen, blistered, or peeling skin with or without fever, wheezing, tightness in the chest or throat, trouble breathing or talking, unusual hoarseness or swallowing of the mouth, face, lips, tongue, or throat. Signs of liver problems like dark urine, feeling tired, not hungry, upset stomach or stomach pain, light colored stools, throwing up or yellow skin or eyes, chest pain or pressure, shortness of breath, coughing up blood, swelling, warmth, numbness, change of color, or pain in leg or arm, very bad headache, very bad dizziness or passing out, weakness on one side of the body, trouble speaking or thinking, change in balance or blurry eyesight, very upset stomach or throwing up, very bad belly pain, back pain, bulging eyes, change in how contact lens feel in the eyes, change in eyesight, a lump in the breast, breast soreness or nipple discharge, breast pain. Well, if you're having breast growth, I don't say that's necessarily a side effect because that's what hormones do when your breasts are growing. So still make sure your doctor knows. Make sure it's not something else, because on the hormones, I have had breast pain, tons of it, and I'm still having breast pain because they're still growing, even though I've been on it for such a long time. Vaginal itching or discharge, vaginal bleeding that is not normal, low mood, depression, mood changes, memory problems or loss, fever, not able to pass urine or change in how much urine is passed, pain when passing urine, swelling. Okay, I'm going to stop here so I can come back because I have to stop. My camera's about, the battery, no, the memory card is about to be full. So I'm going to stop here and resume. What are some other side effects of this drug? All drugs may cause side effects. However, many people have no side effects or only have minor side effects. Call your doctor or get medical help if any of these side effects or any other side effects bother you or do not go away. Okay, headaches, hair loss. Well, for me, I didn't have hair loss. When I started the hormone replacement therapy, I actually gained hair along the hairline here. That's, with me, not all people that happens with. Upset stomach or throwing up. Yes, I've had that happen while taking it, but it wasn't from the progesterone. I mean, it was partly from the estrogen. Some of it was from one thing, not another. cramps, bloating, enlarged breasts, breast soreness. All those can happen, especially if you're taking progesterone with it, because that's what progesterone does every single month. That's one of the natural things the hormone naturally does every month with the changes. Vaginal bleeding or spotting, painful periods. So just make sure these are not all the side effects that may occur. If you have questions about side effects, call your doctor or medical advice about side effects. You may report side effects to the FDA at 1-800-FDA 1088. You may also report side effects at, here's the information, right? If you can see that, it's right where my fingers are. Yeah. www.fda.gov/medwatch. Okay. How is this drug best taken? Use this drug as ordered by your doctor. Read all information given to you. Follow all instructions closely. Take this drug at the same time every day. There may be days when you will not take this drug. Take with or without food. Take with food if it causes an upset stomach. For me, it never caused an upset stomach, and the way I took the estradiol when I was on the Estradiol Oral Tablets, the way I took it every month, like every day, I would because I was on 6 milligrams, so I split it up evenly. 1 in the morning, 1 in the afternoon, 1 in the evening, 1 pill. That would be about like 7 hours, 6 hours, 7 hours apart. So for instance, like 7 in the morning, 1 in the afternoon, 7 in the evening. That's how I would do it. And I would take it sublingually, that means under the tongue, because when you take it under the tongue, it gets into your bloodstream faster and bypasses the liver. Sorry for that noise if you heard any in the background, it was the dog. But that will help bypass the liver as much as possible and get more into your bloodstream. That's what I suggest. But still talk with your doctor when taking it. And taking it that way, I had less ups and downs with the peaks of the hormones. Because when I was on 2 milligrams, I noticed everything is just fine. And when I got on the 4, then I switched to taking 1 in the morning, 1 in the evening. I noticed in between that drop in the hormone, I could actually feel it until I got on the 6 milligrams. Then, during that time in between, when I started taking it that way, I didn't feel the drop as much. I only felt it at night after the 3rd dose actually dropped off. So be aware of that. That's how I felt. It was off during all night long. But what I'm taking now, I don't feel that. So that was my experience when I was taking the oral tablets. Okay, what do I do if I miss a dose? Use a missed dose as soon as you think about it. If it is close to the time for your next dose, skip the missed dose and go back to your normal time. Do not use 2 doses or extra doses. Yes, I have done that, what you're not supposed to do. When I missed a dose, I actually have done that. And there was times where I didn't feel good when I did that. So from going my experience, I suggest don't. Just skip that and actually keep it, because then you can still use it later. Then you'd have an extra dose. So if multiple times that happens, then you end up having a little bit more of your pills left. So try not to miss a dose. It's not fun. How do I store or throw out this drug? Well, okay. Store at room temperature. Store in a dry place. Do not store in a bathroom. Definitely not in the bathroom. This is the reason why. Kitty, kitty. It's because, especially if it's a bathroom where it has a shower, that moisture will damage the prescription. What happens is, if it gets into it, softens it and starts to dissolve. So be careful about that. And also make sure, I've had this happen when getting the prescription, make sure it's not broken. And talk to the pharmacist if you end up finding any of them broken when you get it or first open it, so they can make sure that doesn't happen. Because I've had that happen before, so I wasn't able to get a full dose out of that one, which is so frustrating to keep getting broken pills, like multiple pills broken. But after I talked to the pharmacist and they got the issue resolved, that hadn't happened. That stopped happening. Because at first it wasn't happening, then it started happening, becoming broken in the bottle. And yeah, so talk to your pharmacist about that if that ever happens. Store in a dry place, do not store in a bathroom. Keep all drugs in safe place. Keep all drugs out of reach of children and pets. Because pets will go and try to eat it and lick it. Sorry for the loud noise. It's the kitties. Hey, kitty. Okay, check with your pharmacist about how to throw out unused drugs. Well, I suggest keep it. If you have extra and you're still taking the drug, the prescription, I say just keep and use it. Or if you want to stock up, to have it just in case there's an emergency situation, like out there, like natural disasters or something, and you aren't be able to get your medication, that extra would be a good way to have something in a time like that. If you have any extra, just save it just for something like that. That's something you can do with it. That's what I suggest. Among other things that I'm not going to mention. So, general drug facts. If your symptoms or health problems do not get better, or if they become worse, call your doctor. Do not share your drugs with others, and do not take anyone else's drug. Keep a list of all your drugs, prescriptions, natural products, vitamins, over the counter with you. Give this list to your doctor. Your doctor should know everything you're taking, and if you're going to be wanting to take something like multivitamins or something, just talk with your doctor to see what's okay and what isn't, if you actually need to take something. Because I was taking, because the doctor I was seeing before, she put me on like the baby aspirin, the 81 milligrams a day to help prevent blood clots. But then the doctor I'm seeing now, she said it's not necessary due to my age. I don't need to. And I feel fine not taking the aspirin. So talk with your doctor on other things you may be taking. Talk with your doctor before starting a new drug. That includes over-the-counter natural products, vitamins. Some drugs may have another patient information leaflet. Check with your pharmacist if you have any questions about this drug. Please talk with your doctor, nurse, pharmacist, or other healthcare providers. If you think there has been an overdose, call your poison control center or get medical care right away. Be ready to tell or show what has taken, how much, and when it happened. That's very important because kids or babies, if they actually get a hold of it, they will put it in their mouth. And you don't want that to happen. Sometimes your pets, if you set it down for a second, that can happen too. So be careful with all your medications. Doesn't matter which ones and not. And store it properly. It will help prevent this. The way I store it is in my bedroom, in the closet. Or if you have a cabinet in your bedroom or somewhere where it's not going to get excess heat, excess moisture would be the best. To keep these risks down. So please don't let any of that happen. From my experience, this has come from my experience. Make sure your pets can't get to it. Because yesterday, one of my prescriptions, the cat, wasn't yesterday, it was the day before, he wanted to lick it. I sat it down. He ended up wanting to lick it. And yeah, be careful. Yes, even though that would have been my fault, but be careful. Yeah. Consumer information use and disclaimer. This information should not be used to decide whether or not to take this medicine or any other medicine. Only the healthcare provider has the knowledge and training to decide which medicines are right for a specific patient. This information does not enclose any medicine as safe, effective, or approved for treating any patient or health condition. This is only a brief summary of general information about this medicine. It does not include all information about the possible uses, directions, warnings, precautions, interactions, adverse effects, or risks that may apply to this medicine. This information is not specific medical advice and does not replace information that you receive from your healthcare provider. You must talk with the healthcare provider for complete information about the risks and benefits of using this medicine. And I really strongly, from my personal experience with this, I've done the research before I even started. I did years of research before I even started hormones. Do the research on your own. Look up everything you can on this. And this video is a good start, advise to just do further research and further thinking with yourself, is this right or is this wrong for me? Because when you take this, everything that was described in this video can happen. It may or may not happen. So, from my personal experience, do the research as much as possible. Take your time. Don't rush into it. Especially if you're a trans woman or a teen, a trans girl who's at that age. I strongly, from my deep down in my heart, do the research. I've been there. I've gone through this. And in the long run, it will help you and you'll be happier. I can't give any medical advice, but from my experience as a trans woman, if you're trans out there, and this is why you're watching this video, a higher dosage helped me more than a lower dosage. So be prepared. Be prepared. 6 milligrams was better than 4, was better than 2. Better than 1. And I've taken all those dosages. So from my heart, in my experience, do the research, talk with your doctor, and try to get on the highest dose possible, the maximum for your body. Because not being on the maximum, it sucked. My body was underdeveloped because of it, especially these for such a long time until I got on that higher dosage. Then everything went normal. So if you can't take the injections, this is a good alternative. And just all my suggestions, take that to heart from my experience as a trans woman. And talk with your doctor, research, research, research. And from the bottom of my heart, I'm sharing this information to help you along with your journey.